So some of the most common skin diseases are acne, rosacea, eczema, and certainly we see a lot of psoriasis here. Psoriasis is a skin disease that's kind of changed over the years from being something that we thought of as just being a skin disease probably 15 or 20 years ago. And then we slowly realized that it caused a lot of arthritis, and we now estimate that it's somewhere between 40 and 70% of psoriasis patients will develop an arthritis. What is fascinating in dermatology is over the past 10 years, the entire field has evolved, and we have gotten to use drugs that are much safer and much more targeted for psoriasis. And as we've been using those drugs, we've realized how inflammation, which we see as the main problem with psoriasis, it's a chronic inflammatory condition, how that affects all the other parts of the body. So you tend to see that inflammation increases heart disease, that increases cholesterol, and a lot of patients with psoriasis have comorbidities such as hyperlipidemia. They also have depression and alcoholism. We see a lot of obesity in this population. One, because of the stigma of having stuff on the skin where they don't want to get out and they don't want to show their skin, but also the arthritis component. A lot of the times they do not have the mobility to exercise. And then you throw depression in there with that, and you've got multiple factors all going together. So what is incredible about the past 10 years is we've had a lot of drugs released called biologic drugs. Mainly dermatologists are using these over a primary care physician. A lot of primary cares are very capable of treating psoriasis, particularly when we are just seeing small patches on the body. But once the skin disease surpasses about 10 to 15% of the body surface area, it's generally a good idea to get a dermatologist involved, because when we're seeing that much inflammation in the skin, we know that there's that much internal inflammation going on in the body. What is very interesting about this new subset of drugs is that they have a way of going to the particular part of the immune system that is hyperactive in a patient with psoriasis to decrease all those inflammatory markers, which is not only helping the skin, but it's also helping